Now, okay. Now this patient has been referred for protuberant abdomen. If the abdomen is as tight as we see in peritonitis, and now the history is, as per the patient and her referring doctor, that she had a spontaneous abortion of a 20 weeks fetus, and that they have personally seen the fetus was in full parts have been seen with complete evacuation of the placenta. Now, I don't know, but this is as per the patient's history and referring physician. What I see is that this is the uterus. Here we see this is the uterus, and it measured 6.4 by 2.0 centimeters. Now I think why it is measuring a bit less is because of a lot of fluid with septas within wall of the abdomen. The pressure is reducing the anterior-posterior diameter of this uterus. Otherwise, this will be taken as a small size uterus in anterior-posterior diameter. Okay, then this is the, you have seen, this is the uterus. This is the uterus, and the endometrial canal shows nothing. There are no RPOCs, and it is central and clear. This is the endometrial canal. This cervix. Now, what are these two structures? Let's see. Okay, here comes the right ovary in front of me. This is the right ovary, this one. Okay, and this is the right ovary. And I tell you what, that this is the left ovary showing a follicular cyst. Follicular cyst, and now this is the transverse section of the uterus, and still you can see that the endometrial canal is central clear. This is the myometrium. This is the fluid that I will show you later on. So this is the uterus. And this is the uterus, and this is the transverse section. This is the longitudinal section, same patient. Now I think that I have, now you see, I am going to tell you one very important thing. You see, this area appears as a cyst, and I also mentioned that this is a follicular cyst. Now the thing is, whenever you see any cystic area, you give it a sweep. The cyst will not change its shape, but in this case, it has changed its shape, has become longitudinal, there are echoes within it. So this is not a follicular cyst. I did it intentionally, that maybe someone of you pick it earlier. So this is not a left ovary, neither it is it's simply fluid posterior to the uterus, and this is the. Now I'm going to start from the epigastric region and come. I will bring the probe down to the pubic region and see what are you seeing. whole of the abdominal cavity is full of this picture, which is that there is fluid collection and there are multiple uncountable communicating and separate septas, thick and thin, XY, all type of septas. Now from the epigastric region, now I am coming down. This is the umbilical region, there down, and here I am at the pelvic region. Now this is the longitudinal section showing you the right adnexa, and you can see that this is all fluid. Uterus is being surrounded by fluid from all sides. If you can see this is the uterus, this is the endometrial canal, and it is being surrounded by fluid from all sides. Though no breach is seen in the myometrium, then something have happened. What is the cause of? Now I am into the left flank. See, same picture. And now I am going to go towards the right flank. Now this is the right flank. Same picture. Same picture. Nothing different, no calcification seen. And now you see that these septas or thread-like thick and thin structures within this fluid are non-mobile. I am keeping the probe still at this location, and you will see no movement. We will not see any movement in it. Okay, now I'm going to scan. Excuse me, sorry. Yeah, the liver. You see, the liver is by itself normal, and the kidney is normal. Now this is the liver, smooth outer surface, and normal parenchymal echogenicity. Kidney is also normal. This is all fluid. So fluid is seen in the Morrison pouch. This is the Morrison's pouch. Yeah, this one. So everywhere you see this, there is fluid in the abdominal cavity. Upper portion of this mass is a bit clear of septas. This portion, this is total fluid, and the fluid volume is approximately the fluid volume is approximately okay, this I can just have an rough idea. It is approximately 841, and I tell you what, when this is going to be open, the volume is going to raise more than a liter. Now this portion is only that of the fluid. It's not that of the total total abdomen. So now one thing comes in mind, that what is the reason? What happened? Let us see the spleen. You see, spleen is normal. Now the left kidney appears normal, and from here again the same starts. All the same picture that I have shown you and showing you repeatedly. Thick band of linear structures within this fluid intermingling with each other, and this is the fluid part. Yeah. Now this is the fluid, and these are the thick bands of tissue, all septas. Now see, what is this? What is this white band of tissue? And you know what? It is first one thing. You can see that the fluid is up to the anterior abdominal wall. This is the anterior abdominal wall, and the fluid starts just beneath the anterior abdominal wall, everywhere, all of the abdomen. Okay, now what is this white structure, band of tissue? Actually, what has happened is that this is a retained placenta. This area, this white echogenic area, is the placental tissue that is remaining and is in the abdomen. This is the fluid, septated fluid. Now the history dates back to 5 months back. So what has happened? Actually, the placenta was partially expelled. Sorry for that. So the placenta was partially expelled, and part of it remains in the abdominal cavity there you've seen. And also note that the fluid, septated fluid, it is up to the anterior abdominal wall. This is the, and I can follow this white band of tissue up to the right lumbar region, and from here it's seen up to the level of, it goes posterior-medially, this white band, the placenta, the retained placenta. Now what happened is that this band I am talking about is the retained placenta. Now what happened? I think what happened is that slowly, gradually, the fluid has been accumulating. They have been going from one doctor to the other, and she has been prescribed antibiotics, a lot of antibiotics, etc. And when this has grown enough to make her abdomen protuberant, then now she visited LHV that she sent this case. Now the placenta is at the posterior level of the this whole issue. You see, this is again placental part. This is the placental tissue. And again you can see that this placental tissue lying posteriorly in this separated fluid, and this fluid fills all of the abdominal cavity, is separated and it's just below the anterior abdominal wall. So this is, and later, infection and all sort of issues that can develop. He is lucky to, be here with us. This is the urinary bladder. Now this is the urinary bladder, and from here immediately lateral to the here fluid starts and then occupies all of the abdominal cavity. And this fluid having a linear structure with having linear thread-like areas converging. They are all converging down into the pelvic region. Yeah, here this is the pelvis. So we see that they all of them, they converge towards the pelvis. There you see rest is occupied by the fluid, and this actually it starts from this region, from the pelvis. Fluid with echoes, you can see echoes moving, and then it goes up to the epigastric region, where I've shown you an area which is consistent with being a placenta, retained placenta with complicated ascites. It can be bleed as well. I'm not sure, but can be a bleed as well. So why we saw the anterior posterior diameter of the uterus less was because of this large amount of fluid within the pelvic cavity, as well as in the peritoneal cavity. So this is our case of the day. This is the uterus in longitudinal section. So remember, this is not a cyst. This is in fact the same fluid. This is fluid, and this is the placenta. So a case of retained placenta with associated complications. Thank you very much.